Thank you for being here and sharing your story with us. Pat ended up having a problem with her back and leg on February 26th, ended up going to the hospital. And then she came here on March 24th, started the FX treatment. She's had a total of 4 treatments so far. And I'm going to let Pat tell her story. So, good morning.
Good
Pat.
morning. On the 26th of February, I ended up with an acute sciatica on my left side. How I knew that was the intense pain. Eventually what happened is I could not bear weight on my left side. So I fell 4 times on the 26th. The morning of the 27th, we ended up calling ER and I was taken to the hospital and ended up in emergency. I sat in emergency from 8:30 in the morning until 9:30 at night. What they gave me was they started me on fentanyl. Then I went to steroids going into the port in my arm. And the last thing that I remember them giving me as I asked the doctor what he was giving me was morphine. And of course, with that, then I went out. I laid in the ER because the hospital could only accept so many patients because of staffing. Obviously, it ended up working. I was able at the end of the evening to stand, to go into the bathroom, to bear weight on my left side, which to me was very hopeful. I went back to my place on the ER. At 9:30 that night, the nurse came in and gave me my evening medications, and the person that does admissions said they had a bed for me up on the 4th floor, of which I was immediately transferred up onto the floor, and was admitted to that floor. I was there until 2:30 the following day of when I was discharged. So why I came to see Dr. Gilbert was obviously in the past I had also had a right sciatica and came to Dr. Gilbert for relief, of which I got. This time I came to Dr. Gilbert again for that kind of relief, and he introduced me to FX 450.
So you started the procedure on March 24th.
Correct.
You've had a total of 4 treatments.
Correct.
And how do you feel?
I feel wonderful.
Do you have any leg pain?
I've got a little in my left knee, but that's not what we're concentrating on right now. What we're concentrating on is my sciatica, and both sides of my sciatica feel very good. My back feels wonderful.
So Pat's now getting a treatment with a 405 FX for her low back condition, along with some green light laser therapy. And this goes on for 20 minutes. And it has an FDA approval and clearance, and the outcomes that we're seeing right now are just phenomenal. And you don't feel any pain or discomfort when this laser is on you, correct, Pat?
Correct.
So Pat is having some 405 FX laser treatment on her low back, but we also have a pulsed electromagnetic frequency pad that is also regenerative medicine on her back. And what we have here is a Gauss meter, which is showing you exactly what is actually going through her. She can't feel that, but it is happening, and the meter is just showing you what is actually happening. Allison is giving a treatment with Pat through the brain with the GVL, or the green light laser, and this is going to help with the pain. And
Correct.
So Allison, you want to explain a little bit why you're doing the green light through her brain?
It's part of the pain protocol because your brain is your computer center. And as we all know, people that have lost limbs will have what's called phantom pain, even though the limb is no longer there. The brain is used to having pain in a certain part of the body, and even if the triggers for the pain are eliminated, the brain may still expect it and tell you that there's going to be pain. So what this does is it's helping to rebalance things in the brain and hopefully turn off that expectation that there will be pain so that they can experience the joy of not having the pain and not have the brain telling them that it's still there. So it's just part of the pain protocol. So I do 3 minutes, and I just kind of scan along with the FX405 as part of our pain protocol, and it seems to be working really, really well.
Thank you.